And a question for you, Josh, about surgery specifically that I was seeing earlier too is that, the medicine and surgery in general are constantly changing. The way that things were done maybe decades ago isn't the way that things are going to be done in the future. And is there any sort of trajectory that you see the surgical field going forward? So somebody who's sitting here right now who's a pre-med and wants to become a surgeon, how do you think that being a surgeon is going to look different in maybe 10 or 20 years than it does now, or maybe even the process of becoming one?
Great question. Surgery is slow to change, but has undergone significant changes over the past 50 years. For example, we used to do all procedures with big incisions and now we've really started to do a lot more what's called minimally invasive surgery, where we can do similar types of procedures through smaller incisions to deliver smaller instruments. We still do large open surgeries, but there's a lot more emphasis on trying to use technology. So robotics has become a big part of a general surgeon's practice, and in some subspecialties as well. And surgical culture and the training itself has changed. It used to be that 20 years ago, it was a resident doing a case by themselves in the operating room with an attending surgeon nowhere in sight. And now there's a lot more structure and feedback in order to try to make sure that the surgeons that we're graduating know how to do procedures and are safe to do them independently. And surgery is going to continue to change as we begin to experiment and integrate things like artificial intelligence in our preoperative, intraoperative, and postoperative care. Things will hopefully become a lot more streamlined and allow us to spend more time doing the things that we like, which is operating and talking to our patients. And our culture is only going to get better as people who have now or are training in the current experience, which is a lot more open and transparent compared to how it was, will rise into positions of leadership and start to enact change through policy. So the future of surgery is great and will continue to get better as we start to integrate technology.
I love that. That's a great answer. And yeah, the future of medicine and surgery is going to look different than what it was now. And I remember when we were in medical school, we were told, some of the things that you're learning about now, they might not even be true in the future, right? Like we are constantly learning more about medicine. We're constantly learning more about the human body and different ways to treat diseases and overall about different diseases. So there's a lot of exciting things happening in the future, and medicine is just a great field to go into. So the next question then is for Melina. I know we have about 7 minutes left. So a quick question for you is, where do you see the future of medicine or your field in particular going over the next few decades?
The good thing about internal medicine is that if you have commitment issues, so to speak, like you don't have to commit yourself to something right away. You can still do something procedural, you can still do something non-procedural. And so the doors have always been open, I think, in that regard, with regards to an internal medicine specialty or residency and what you can do after. But I think with technology and with AI, I think it's going to get even more broad. I think that's not only for IM, I think that's for all medicine specialties. Maybe more opportunities to work from home, maybe more opportunities to do, again, like less invasive things. And so that's kind of where I see medicine heading. I think it's going to be a lot easier to communicate with our patients. And we're going to have a lot of different perspectives come in because of that. So I kind of see that as diversifying the internal medicine experience and being able to be even more broad, not to commit yourself to something so soon.
Yeah, great. And so we have a few minutes left, and I want to make sure each one of you gets a chance to sort of say your final words to everybody who's watching, right? This is your chance to sort of give the biggest piece of advice you would have for somebody sitting right now watching on their Saturday evening, hearing from current physicians as people who want to become physicians. I'm going to give each one of you the chance to answer essentially, what's your biggest piece of advice? What's the takeaway that you want students here watching right now to really benefit from in like 1 or 2 minutes? And we're going to start with Dan.
All right. So I would say, remember what it is that you're going into this for. It's a very, very long journey, and it's very stressful and emotionally challenging. And you're going to get to many points where you're going to be like, why did I do this? What am I doing here? And you're going to have good friends, classmates who are going through this with you, who I hope that you'll be able to lean on, who can remind you. Family members can do the same thing. Significant others can do the same thing. But there's going to be those points where you're going to be like, wow, what am I here for? And then you're going to, something great's going to happen. You're going to get a good exam score. You're going to nail an OSCE. You're going to see a patient and you're going to catch this crazy illness that is very uncommon. And you're going to feel so good about it. And you're going to be like, this is what it was for. So it's kind of a roller coaster. And like I said, it's very long. So just remember what you're, why did you come to this seminar today? Why did you decide to throw your name in the hat? Or whatever that was, or whoever it was for, just remember that when you're going through it, because you're going to need that motivation. Unfortunately, you're going to need it a few times. So, and then beyond that, just like I said earlier a few times, so like be yourself. The most important aspect of, I think, patient care is the authenticity of the physician or any other provider that's providing the care, because really it's trying to meet somebody where they are. And oftentimes what can be their most vulnerable way. And if you're not even being true to yourself, you can't possibly provide that patient with the best care. So remember why you're doing it and be your authentic self, and that'll take you a lot of places.
Awesome, great answer. And feel free to drop your sort of Instagram or anything, any way for students to get in contact with you in the chat if you'd like, and share that as well, because I know a lot of people have a lot more questions than we were able to get through today. But thank you so much for being on the panel. Josh, I'm going to ask you the same thing. What's your biggest piece of advice to everybody who's watching right now?
Yeah, I think it's be honest with yourself and what you want to accomplish during your life. If medicine is something that piques your interest and keeps you going, and your daily interactions with patients are the things that make everything else worth it, then focus on that and keep going. For surgery, for example, a lot of people go into surgery because of like I mentioned, the tangible impact that you can have on your patients. And despite all of the bureaucracies and paperwork and stuff that we have to deal with, all of that we do in order to continue to be in the operating room. The operating room is our safe haven, for example. So if that's your thing, then continue to do it and don't let anybody stop you from doing it. Put your 100% in, take breaks when you need it, but continue to follow your passions vehemently. That being said, if through your experiences you realize this isn't for me, then take that and go somewhere else, because nobody's going to benefit from that type of exchange where you're not interested in it, and ultimately your patient feels like you're not putting your all into it, and you might be happier in a different field of medicine or outside of medicine completely. So be honest with yourself, and as long as you're passionate about something, that will continue to push you through more than any amount of money or anything like that. Pay attention to your intrinsic motivation for why you're there. So I have difficult times during surgery residency where I have to work long hours and I'm under a lot of stress. And then I have an interaction with a patient where I realize, wow, I'm actually helping this person navigate this really complicated system and can help them feel better and get to the other side of this. And that makes it all worth it. So continue to follow your intrinsic motivations.
Thanks so much. And I see you're writing in the chat for how people to get in contact with you as well. Thank you so much. And now for our third panelist, Melina, what advice would you give?
I think we kind of all have the same advice, which is I personally think that medicine is my favorite job. It's the best job. It's the only job I could really see myself doing. And I love it. I really do. Even at the end of the day, you come home and you still have to find those gratifying experiences that make you want to go in the next morning. And while it is the best job, in my opinion, and it's amazing, it's not worth losing yourself over and losing who you are, which is, I think, the most important thing. So as much as you love it and as passionate as you are about it, if it's something that you're losing yourself over, go back to the things that make you who you are, that you're passionate about. Maybe it'll lead you back to medicine, or maybe it won't, and that's okay too. But it's definitely not worth your mental health or your life or losing your interest outside of medicine. If you come back and you veer back to medicine, then you're gonna get a lot out of it. But that's the way I feel, and that's my take-home message. And the last thing I'll say is college is the last time you really have to take any class you want in like any breadth that you want. And I wish I had taken more like really unique and cool classes that I wouldn't be able to take again. So don't worry so much about taking that extra like neuroscience or like physiology class to look good for your med school application. Take something cool that you can talk about and that you'll never be able to do again.
Amazing. Thank you so much to our three panelists. That was incredible. This is so informative. And I see people in the chat who are just reinvigorated into their passion for medicine and surgery. And I know that a lot of people are going to be contacting you individually. Thank you again so much for taking the time. You guys are free to log off, and I'm just going to do a quick recap for everybody who's the participants on the panel. But thank you so much to our panelists.